One of the most frequent questions I get is surrounding how to support a loved one with mental illness. It's one of the reasons I talked about schizophrenia a couple weeks ago. And if you haven't listened to that episode, please go check it out. Supporting a family member with a chronic mental illness requires understanding, patience, and consistent effort. Today, I'm going to provide you with a few tips to get you started on this journey. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence based approaches, a sympathetic ear, and zero judgment. The first tip may seem obvious, but you want to increase your knowledge of their specific mental health condition. Chronic mental illnesses are long term conditions that can affect a person's thinking, feeling, behavior, and ability to relate to others. Common examples include schizophrenia, bipolar disorder, major depressive disorder, and anxiety disorders. Understanding the specific illness your family member or close loved one is facing is the first step in providing effective support. So, how do you go about learning about the illness? Well, you want to do a little bit of research. Read books, articles, and reliable online resources about the specific mental illness. While you may find personal accounts of mental illness online, you do not want this to be the basis of your research. Please be sure to identify verifiable sources when doing this kind of work. I also want to encourage you to talk to professionals. So consult with doctors, therapists, and support groups for firsthand information. Another thing to keep in mind is you want to deepen your understanding of the symptoms and the triggers. One of the reasons why is you want to be able to identify symptoms to better understand what your family member is experiencing. You also want to know their triggers. So learn what might exacerbate their condition, such as stress, lack of sleep, or specific situations. The next thing you want to consider in supporting a person with mental illness is your communication skills. If you're not the best communicator, you may want to work on improving these skills across time. Having the ability to be a good listener, which includes listening without judgment and showing empathy, is a skill you want to develop. Even if you actually feel non judgmental and empathetic, we may not always be the best at communicating it, especially when we're dealing with an individual who may be irritable or under duress. Secondarily, to my point about the varying emotional states of others, it's also important to learn how to communicate clearly to someone who may be in an impaired state. There are support groups for caregivers, and you can also work with your own therapist to improve these skills. Generally speaking, when supporting someone with chronic mental health issues, you want to encourage them to actively engage in their treatment. Depending on their diagnosis, this could be simply weekly therapy all the way up to day treatment, where a person is attending multiple sessions per day. In many instances, folks will need to meet with their primary therapist, who would likely be doing individual therapy with them each week. And also, they might have a prescriber who's doing medication management. This could be monthly or even quarterly, depending on what their situation is. In terms of their medication, you may have to check in that they're actually taking their medications as prescribed. Additionally, I want to mention that depending on their situation and their treatment plan, they may also have assigned case managers or home health aides that help with activities of daily living. Activities of daily living are things like our hygiene related activities, making sure we eat meals, that sort of thing. If you're supporting someone with mental illness, encouraging them to have routine and structure is really important. So help them to establish a daily routine to provide stability. This is helpful to everyone, but especially those with chronic mental health issues. Routine and structure lead to less stress overall. Depending on the needs of the individual, you may also have to assist with chores and daily tasks that may be overwhelming for them. I will also say that sometimes there may be a task that seems incredibly easy to you, but it might be extremely difficult for them. So please keep that in mind. In that vein, I also want to encourage you to celebrate small wins. So you want to acknowledge and celebrate their progress, no matter how small it is. When they're able to set realistic and achievable goals, in the long run, it'll help them to build confidence and a sense of accomplishment. The next thing to mention is around kind of crisis planning and other supports. The first being emergency contacts. You want to keep a list of emergency contacts and mental health professionals. It's also important to know what their crisis intervention plan is. And if you don't have one, basically, you want to develop a plan for handling emergencies, including recognizing warning signs and knowing when to seek immediate help. And I'll also mention it's important to encourage that they engage in social interaction. So you want to encourage them to maintain relationships with family, friends, classmates, anyone who they can have a positive interaction and create a positive environment with. This may also include encouraging them to join support groups where they can interact with other people who have similar struggles as them. I would be remiss if I didn't mention you taking care of your mental health. It may go without saying, but being a caregiver is really difficult. So I'm always encouraging those who are caregiving or providing support for another person to consider therapy for yourself. This will go a long way in managing stress and giving you a space to process your emotions. The same way that I mentioned support groups for those with mental illness, I also encourage support groups for caregivers. This is a great way to get support and validation and to interact with other people who are going through the same stressors that you are. The next thing I'll mention is to set boundaries. You want to establish clear boundaries to protect your own well being. I also strongly encourage taking breaks. And when I say breaks, I mean regular breaks throughout the day. Also, don't ignore your needs for vacations or to take a night off if you're a person who's providing 24/7 care. Also, look at your nutrition and exercise. Try to eat a balanced diet and engage in regular physical activity. This will support you so that you can support them. Sleep hygiene is also incredibly important. Try to establish good sleep habits because this is going to be crucial to maintaining your mental health. Being a support or a caregiver for another person is highly stressful. Do not hesitate to listen to what your needs are and seek out supports. If you don't, all you're doing is setting yourself up to be burnt out or to see your own mental health tank. As much as we're encouraging our loved ones to take care of themselves, we really do have to practice what we preach. Have you found any resources that have helped you be a better caregiver? Let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg, with script editing by Brandon Getches. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.